Well, ketamine therapy for mental health has really grown in popularity in the U.S. in recent years, despite the drug not being approved for mental health treatment. But some people insist it's the only thing that helps. Denver 7's Colette Bordelon spoke with a patient and with a provider to find out more about the treatment.
So I went to med school, not planning on psychiatry, and then ended up just loving it.
Just south of Denver.
It's like a reprieve from what my life is
a practice that's personal for the patients.
It's honestly insane. It's hard to describe.
Part of the therapy for Miranda Spencer are ketamine infusions.
It is one of the safest anesthetics. That's why it's used in pediatrics a lot. Using it in a medical setting is very different than using it recreationally.
Dr. Beth Ballin says in 2012, after doing her own research, she became the first prescriber to provide ketamine treatment for depression and mood in the Denver area. Ketamine is only FDA approved as an anesthetic, not for treatment of psychiatric disorders, but for Spencer, these infusions are invaluable.
Reminding me that I can do this and I can keep pushing and I'm going to be able to survive this.
She's been getting the treatment at Dr. Ballin's office since April of 2023.
My father passed away and I was struggling with some PTSD symptoms. You know, when you lose a parent, it kind of feels like a part of you. You're losing a part of yourself.
It was November of 2023 when Spencer suffered another kind of loss.
When you're sexually assaulted, it feels like your whole you kind of dies. It's like you are just a completely different person.
Dr. Ballin wanted to see Spencer as quickly as possible, saying ketamine has the ability to grow new neurons in the brain, changing how trauma imprints on a person. And the hope is preventing long-term PTSD from forming. More traditional therapies are part of her practice, too.
So you can't just give ketamine in a bubble. And I think that's why we have such a high success rate.
For Spencer, it's a chance to reset.
It saved my life so many times.
But Ballin says it's the patients who prove change is possible.
And it's kind of like I didn't save your life, you did.
Colette Bordelon, Denver 7.
The FDA acknowledges there is interest in the use of ketamine for depression and chronic pain. And those with UC Health say when ketamine is used in safe, supervised settings with medical experts present, it does appear to help people with treatment-resistant depression. But they say more research is needed.